So today somebody asked us about divergence insufficiency, and what this means is you have an insufficiency, that is not enough, of divergence. And so there's two types of movements that we have with it, which are bilateral and conjugate. So when you have the two eyes moving together, they can move in the same direction, which is called a version. That's different than the one eye moving, which is called adduction. So when the two eyes move together in the same direction, that's version. So it can be dextroversion to the right, levoversion to the left. However, we have this different kind of movement, which is called vergence. Vergence is when the two eyes are moving in the opposite direction, but they're both going towards either adduction, that's convergence, or abduction, that's divergence. So vergence movements are adducting or abducting both eyes at the same time, at the same speed together, and that vergence movement can be insufficient. So you should watch the video on convergence insufficiency first, because this is so super common. So when you cannot converge, you're going to get exotropia. The eye's going to turn out because you can't turn your eyes in. And that's going to be an exotropia at near, and that's what that little apostrophe thing looks like. And the exotropia is going to be greater at near than at distance, because it's a convergence problem, because you're trying to focus on something that's close to you. This convergence insufficiency is super common. It's one of the most common causes of diplopia in all the neurodegenerative diseases, for example, Parkinson's disease, but age or anything that breaks your fusion really can cause convergence insufficiency. Divergence insufficiency is the opposite. So instead of an exotropia, you're going to have an esotropia. And because at near you already are converging, the diplopia symptoms and the esotropia is going to be greater at distance than at near, because you're having a problem diverging from the normal converged position at near. So it's a small angle esotropia that characterizes divergence insufficiency. And as opposed to a sixth nerve palsy, there's not going to be any ductional deficit. The eye can move. It's just the supranuclear control to make it diverge. The divergence fusional amplitude is decreased. There's a lot of controversy about this divergence insufficiency, because if you have a sixth nerve palsy, over time it can become comitant, which means it's the same in all directions, and it can mimic a divergence insufficiency. So it's kind of hard to make the diagnosis of divergence insufficiency. You have to have an esotropia that is greater at distance than near. You should have no ductional deficit. You should have no evidence of sixth nerve palsy. And you have to measure the fusional divergence to confirm that it's a fusional problem from divergence. The reason it's important is, unlike convergence insufficiency, which is common and usually benign, divergence insufficiency sometimes is from something bad. And if you have no divergence, that means your fusion is messed up, and so we would image a divergence paralysis, as opposed to convergence insufficiency, which is so common, we often don't image that. The treatment, however, is the same for convergence and divergence insufficiency: patch, prism, orthoptic exercises, and if you fail all that, surgery to straighten the eyes out. So you should know a little bit about supranuclear vergence, divergence and convergence, divergence insufficiency, ductions are full, esotropia, that's greater at distance than near, patch, prism, exercises, and if necessary, surgery. Image it if it's a divergence paralysis, or if you can't tell if it's a sixth nerve palsy.